All right, so welcome. Our seminar today is titled Medicare Basics, What You Need to Know. And I'm very happy to introduce our speaker today. We have Audrey Darrett with us today. She is a health insurance counseling and advocacy program manager for the Ventura County Area Agency on Aging. She's a registered HICAP counselor, as well as a community educator on topics related to Medicare, Medi-Cal, public benefit programs, and long-term care insurance. She holds a Master of Public Policy and Administration from Cal Lutheran University. So we welcome today, and thank you so much for being with us, Audrey.
Thank you, Martha. I'm excited to be here. We have a lot to discuss, but I will make it as interesting and engaging as possible. So you all are here at least to get some sort of information about Medicare coverage. Maybe you're just turning 65, maybe you're already 65 and on Medicare, but want to know a little bit more. So to start off, I just want to go over just the introduction of what we're going to be talking about, as well as some objectives. We're going to talk a little bit about the Ventura County Area Agency on Aging and some of the services provided, as well as an introduction to Medicare, including how to enroll, the different parts and paths of Medicare. Again, a very basic general understanding. That way you understand your options. And then lastly, maintaining your coverage with some quick tips. So with the Ventura County Area Agency on Aging, we serve older adults, persons with disabilities, and their caregivers. Within our HICAP scope, we take care of Medicare counseling. We operate as a benefits enrollment center, which really points to the public benefit programs that we can screen and assist for. We are part of the Aging and Disability Resource Center, which really is a no wrong door approach, meaning that no matter if you come in through HICAP or another part of the agency, that we will be able to do a referral, a warm handoff to another department. Let's say you needed some other services. And we also operate as a senior Medicare patrol liaison for the county, which means that any fraud, scams that are going on within the county, even if it's something as simple as this flyer doesn't look right, it looks misleading, you can report that to us and we send it off to Senior Medicare Patrol for further investigation. We are a department within the Ventura County Area Agency on Aging, of course, and there are other departments within the agency that can assist in various ways. There's the Information and Assistance Department, which really operates as a call center. That's usually the first point of contact for someone calling into the agency. They'll be able to refer you to whatever department and whatever services that you're looking for. We have the Elder Help program that does help with a few different items, most popular being transportation services, rides to medical appointments, bus tickets, things like that, as well as some respite care, some homemaker services. If someone has a hoarding issue, we can put them on the list through the Elder Help program to get that services of getting that corrected. We have case management programs, really focusing on individuals that are full scope Medi-Cal and need some further assistance with just daily living at home. The fall prevention program, and really a handful of other programs that are there to really just serve older adults and people with disabilities. As far as HICAP is concerned, there is a local HICAP office pretty much in any community nationwide. If someone lives in a rural community, sometimes that county will be comprised of a few other counties in a bigger area. But essentially in every county in California, there is a HICAP office that services them. We, of course, service Ventura County. If you had relatives or peers that lived in LA County or up in Santa Barbara County, we have counterparts in those counties and would refer to those counties as well. We are a direct service, which means that we operate within the walls of the Area Agency on Aging. In other counties, it can look a little bit different. It could be that the HICAP department is contracted out. So you might see that it looks a little bit different in another area. And I just give you that just to be informed. That way, if you are telling your friends or your peers or relatives, that you kind of understand how this operates. But like I said, HICAP is a national program. So beyond California, there are HICAP offices in every state and pretty much in every county. Let's see. So I like to bring this page before we get into some of the nitty gritty information. Decisions. Let's say you are getting ready to turn 65 or retire. You have several important decisions to make. You might be thinking, should I enroll in Part A, which I'll get into, and or Part B? Should I join a Medicare prescription drug plan? Should I buy a Medigap supplemental policy? Should I enroll in a Medicare Advantage plan? And then should I keep my employer or retiree coverage? These are all questions that might be coming up as you are either getting ready to turn 65 or you're getting ready to retire. These are some of the things that you're thinking about. So what I want to start out with first is how to enroll. This also encompasses the when. When is it appropriate to enroll? And really each individual situation, it may be a different answer for that individual. So in a typical age-based, someone is turning 65, at that point, you know that you are eligible to enroll into Medicare. You're turning 65, the month of your 65th birthday, you are eligible to enroll. You will also see that if someone is still employed past the age of 65 and they're still working, that you may be eligible to stay on your employer-sponsored plan and defer Medicare enrollment. So in this situation, we would still recommend that anyone come to us. You're turning 65, whether you're already retired or you're still working, come and talk to us just so that we make sure that all your ducks are in a row so that you can make the decision that works best for you. The other questions that I get is Medicare enrollment automatic? Meaning, when I turn 65, am I just going to be enrolled or not? And of course, my answer is it varies. Yes and no. For some people, including people that are receiving benefits from Social Security, this could be Social Security retirement benefits that you started taking at age 62 or 63 or 64. Sorry. Then for you, yes, your Medicare enrollment is going to be automatic. Same with anyone that is a railroad retiree. We don't see them too much very often anymore, but yes, it would be automatically enrolled in Medicare. And else, so if you're turning 65, you didn't start benefits, you will not be automatically enrolled. You will not get any information about notifying you that you should be enrolling soon. Really, you're not going to get very much correspondence as far as you needing to enroll. So in this situation, again, this is the value of having someone come into us when they think they're going to be Medicare eligible, they're turning 65, come see us so that we know which situation best fits you. Again, with this area of the Medicare enrollment being automatic for some people and not automatic for others, that's where sometimes when you're talking to your neighbors or your other peers and they're saying, oh, I was automatically enrolled. Yep, I just received my card in the mail. That might not be your case. And that's why we say, just come talk to us and we'll get you on the right track. So these are things that you need to be thinking about. The enrollment is not going to be automatic for you if you aren't already taking your Social Security retirement benefits, and if you're not a railroad retiree, you're going to have to initiate that process. So there's also another group of people that are eligible for Medicare, and it's those that are 64 and younger and that have a Social Security defined disability. So people that are receiving SSDI, Social Security Disability Insurance. At their 24th month of the disability designation, so 2 years after they started getting that SSDI, they are going to be eligible for Medicare. In most cases, this group of people, they're going to be automatically enrolled. So they are going to receive their Medicare card in the mail, and that's usually when they call us and they say, "What is this card? I didn't sign up for this." And we go through, those that are younger than 65 that have a disability, a Social Security defined disability. They are eligible for Medicare in their 24th month of that disability, or 2 years later. So that's why you've received your card. It is that time now. So how to actually enroll? You enroll through the Social Security office. Everything from eligibility and any kind of the just general structure of Medicare, you're going to be enrolling through Social Security office or the Social Security Administration. You're able to do this in person. That was prior to COVID. Right now, they are not seeing people in person for Medicare enrollment. You can do it by telephone or online. We would suggest doing it online. But that would be your function. That is your first stop. Once you have all your ducks in a row, you're going to be going to the Social Security office and signing up for Medicare. The other thing that I want you to think about, in you are someone that is again turning 65. Anyone turning 65 that's getting ready for Medicare enrollment, they have what is called an initial enrollment period. This allows them to sign up. This initial enrollment period is a 7-month period, and it runs 3 months prior to their 65th birth month, the month that they turn 65, and 3 months after. That is your green light to sign up for Medicare. If you are looking at signing up for Medicare 6 months in advance to your 65th birthday, although we can talk to you and help you get your ducks in a row, there's nothing that you can do at that point. You have to wait at least up until 3 months prior to your 65th birth month to start making and taking action on your enrollment. So now we're moving into what is actually offered as a part of Medicare. So again, this is a basic general understanding of what is offered to you. So the combination of Part A, hospital insurance, and Part B, medical insurance, is what is known as original Medicare. So when Medicare was first brought onto the scene, this was the original iteration of Medicare, these two in combination. So Part A, hospital insurance, is typically premium free. The reason why it's premium free, which means that you're not paying anything monthly for it, is because you have worked 10 years put at a job putting into Social Security and Medicare taxes. That is why it's free. If someone has not worked those 10 years at minimum, then they are not going to have a premium free Part A. But most people that we work with do have the premium free Part A. So what this covers is inpatient care in a hospital, inpatient care in a skilled nursing facility, not long-term. So we're just talking about, let's say you had a hip surgery or something like that. It would be something like that. Very short term, just for recovery, rehab, things like that. Part A is what covers hospice insurance, and it also covers home health care in certain situations. Right here, written, there's more details to that. I don't want you to take that necessarily for face value, but that is where that is covered, Part A. Part B is medical insurance. So anything doctor services, outpatient care, as well as durable medical equipment, so wheelchairs, anything like that, and preventative services as well are covered under Part B medical insurance. Technically, when you receive a Medicare and U book after you turn 65, you will read that Part B medical insurance is optional. And so I do like to tell people this, it is an optional component of Medicare. However, in Medicare in general, no matter which way you look at it, if you do not sign up when you were supposed to sign up, there can be penalties involved. So although this Part B medical insurance is optional, it's really not all that optional if later down the road when you decide that you want to get it, you want to enroll in it, you're going to have penalties for every month that you did not sign up for this Part B medical insurance. So although it's optional, it's really not that optional, and we would not advise that someone go without, having the doctor's office coverage and things like that. At the bottom of these slides as well, I've put in reference pages where you can find more information in Medicare and U books. We have some at the office if anybody needs them, but usually people get them once they turn 65, they get them every year mailed to them. So again, this is just a basic view of original Medicare comprising of Part A and Part B. How does original Medicare work? So remember, this is one path to Medicare. This is just one of the paths. So how does it work? Some of the questions that we get is, can I go to any doctor? In most cases, yes, you can go anywhere. You can go to any doctor that accepts Medicare, that accepts Medicare patients. And most doctors' offices do accept Medicare patients. I would say 99%. You don't really have to worry about it in that regard, especially when we're talking about original Medicare. Are my prescriptions covered in original Medicare? No. You may want to add prescription drug coverage, also known as Part D, as a part of your Medicare package if you are going the original Medicare route. Do I need to choose a primary care doctor? No, you don't need to choose a primary care doctor. You could bounce around to whatever doctor you want. We don't see many people that do that, but you don't have to select one person to be your primary care doctor. Other questions, should I get a supplemental policy? You may want to look into buying a Medigap to pay for the cost that original Medicare does not cover. Yeah. There are available plans that really work as gap insurance to cover, again, any of the costs that the original Medicare structure does not pay for. Lastly, do I need to get a referral to see a specialist? In most cases, no. But the specialist must be enrolled in Medicare, meaning that your specialist must accept Medicare patients. But in the original Medicare side, you don't need a referral to go see that specialist. So this is the other part or the other path of Medicare, which is the Medicare Advantage plans, also known as Part C. In Ventura County, the majority of our plans are HMOs, which stands for Health Maintenance Organization, really managed care plans. When you sign up for this Medicare Advantage plan, first of all, you must be signed up for both Part A and Part B. So again, that optional Part B, you have to sign up for Part B in order to actually have the Medicare Advantage plan. You have to have both of those. However, once you sign up for the Medicare Advantage plan, it now covers all of your Medicare Part A and Part B services. It covers all of your hospital services and all of your medical doctor's offices services. And in our county, our plans include prescription drug coverage. So now you've just added your prescription drug coverage. This is a full service plan. In the Medicare Advantage side, there are maximum out-of-pocket expenses, which is also, you'll see it or read it as a MOOP, which means that each of a out-of-pocket expense number, which means that you cannot spend more than X dollars in a year. So these maximum out-of-pocket expenses for our Medicare Advantage plans usually are around $4,000 to $6,000. So it does give you some safety in that even if there was some sort of medical crisis, that you would know that there is a cap on what you can spend out of pocket. Just to clarify, the Part B portion of Medicare does come with a premium. Remember how I discussed that most people are eligible for premium-free Part A, which means they're not paying a premium on their hospital insurance. But the Part B premium, there is that premium. So you still are paying that premium plus whatever the Medicare Advantage plan premium is. So you're still paying for Part B, but now understanding that this Medicare Advantage plan is essentially taking and covering all of your medical services within that one plan. A lot of the MA plans range from about $0 to generally around like $30 a month. So they're not that expensive. They're not that much more of an additional cost. So you don't have to worry about something maybe being hundreds of dollars per month in premium costs, but there sometimes is a little cost associated. Medicare Advantage plans also have an additional open enrollment period, which essentially gives you more time to make decisions and switch to different plans and things like that. So in this Medicare Advantage open enrollment period that runs January 1st through March 31st, you may drop or switch an MA plan if you are already currently on an MA plan. So this is something only for people that are currently on Medicare Advantage plans. They are given the opportunity, more opportunities throughout the year to actually make changes. Whereas someone that was on original Medicare, they only have open enrollment that happens in the fall. That's their only time to make changes. Medicare Advantage plan beneficiaries have additional time, essentially. So the same kind of questions. How does Part C work? Can I go to any doctor? No. You must get your care and services from doctors in your network. So I always like to use the example of Kaiser. Kaiser is a really great high functioning Medicare Advantage plan. Just like if you were on a Kaiser plan, you would be going to a Kaiser participating hospital. You would be going to Kaiser doctor's office or clinics or specialists, things like that. And you're actually going to a Kaiser pharmacy to get your drugs. That's kind of the prime example. Some of the other plans don't function identically to Kaiser, but it's the same idea. There's going to be hospitals that participate with that plan, doctors, medical groups that participate with the plan, as well as pharmacies and things like that. So the next question is, are my prescriptions covered? In our county, yes, the Medicare Advantage plans in our county do come with prescription drug coverage. So if you sign up for an MA plan, you're fully covered. You really don't have to worry about, going out and adding anything else to your plan. Do I need to choose a primary care doctor? In most cases, yes. So the HMOs are going to want you to choose a primary care physician right out the bat, and that's who you're going to stay with. Do I need to get a referral to see a specialist? In most cases, yes. So within this structure, your primary care physician or doctor, they're going to need to make a referral for you to see whatever specialist that is medically necessary for you to see. So if we're looking at the original Medicare structure versus the Medicare Advantage structure, the original Medicare structure does offer a little bit more freedoms as far as where you can go, what doctors you can go to, the fact that you don't need to choose a primary care physician, and you don't need a referral to see a specialist. However, that really can be a more costly route, at least upfront, depending on what services you end up needing. With the Part C or the Medicare Advantage plans, again, think of it as managed care. So instead of having kind of a free-for-all, you're having a situation where your plan is working with doctors, working with specialists, working with pharmacies, and they're really the full package deal for you. Especially some people that leave the working world and maybe were really happy on an HMO plan, that could work perfectly for them as they transition into Medicare. And for some people, that does not work for them, or that's not the route that they want to go. So it's a good idea for you to know the options when making your decision as far as which path you want to take. So I'm going to move on and talk about the Medigap, the supplement insurance that is a part of the Medicare program. In order to purchase a Medigap, you must have Part A and Part B. So you must have that original Medicare duo. And understand that you are now paying an additional premium to a private company to cover this supplement insurance. There are time frames in which you are to do this, and it is most effective for you to get enrolled is really when you turn 65 and you enroll in Part B. You have guaranteed rights to be accepted by a plan and to pay the least amount. If you wait after this 6-month enrollment period, then you could go through underwriting, which means that a plan can A, charge you more, B, deny you from being on the plan, and C, ask you about any health related questions or prior conditions and things like that. So if you are thinking that the supplemental insurance side is the way that you want to go, you would want to make that decision pretty much, in the first couple months of you getting onto Medicare. The other thing that I did not mention is in the original Medicare path, that first path that we were talking about, Medicare pays 80% of medically necessary services, which means that the beneficiary is going to be responsible for 20%. So that's where the Medigaps come in. This supplemental insurance is there to fill that gap, up to that 20% gap. And I like to use the example of if there was some sort of medical emergency, it ended up being $100,000, everything was medically necessary, Medicare is going to pay their 80%, which would in this case be $80,000, and the beneficiary is going to be responsible for the 20%, which would be $20,000. So when you decide to go on the path of original Medicare, that's what you're keeping in mind. I am going to be responsible for 20%. There is no cap or limit on what I could pay out in medical. There's no maximum out-of-pocket expenses like we've seen in the Medicare Advantage plans. It really could go, it could be infinite, really, unfortunately. So if you're thinking about going the Medicare, the original Medicare route, you may want to think about getting a supplemental insurance plan so that you can cover some of that 20%. So again, you're going to be paying a monthly premium. And there are varying plans that are offered that are Medigaps, and those plans are lettered A through N, and it essentially means that they have varying coverage. So in order to kind of understand what is best for you, you would want to look at that chart. You would want to make a decision on what works best, and then start getting estimates for what that coverage is going to cost. Typically, for someone that's looking for almost all covered, you're looking at another $150, another $150 premium for this Medigap plan. So, and that's just someone that turned 65. That's just kind of a rough estimate. It could be higher, it could be lower.
Sorry, Audrey, to interrupt, but it cut out for a second. I don't know if that was for everyone, but can you repeat that dollar amount again?
Oh yeah, of course. Sorry about that. So it is around $150. I would say that's a great place to kind of put an average marker on what the supplemental insurance plan costs. And that is assuming that this person signed up right when they were supposed to, they're getting the best price. It could be more and it could be less, but that's a good estimate of what that costs. So if you're taking into account that you want to go the original Medicare route, you're assuming that you are going to be paying your Part B premium, which is a couple $100 at this point, or I'm sorry, $148 at this point. And then you're looking at this other monthly premium, as well as getting a prescription drug plan. So you're paying out in potentially 3 different areas. Something to think about. But the great thing about this is, remember, you can go to any doctor with the original Medicare and Medigap policy, any doctor that accepts Medicare. And remember, you don't have to have any prior authorizations or referrals to see specialists. And that supersedes even the county jurisdiction. So if you wanted to see a specialist at UCLA, in this path, you're able to do that. You don't have to get any other approval. You're just making sure that that specialist accepts Medicare, and then you would be able to see that doctor. Of course, the buzzword for any Medicare service is really paying attention to whether services are medically necessary or not. So it's not meaning that you can just go anywhere for anything. Of course, you would want to be making sure that these tests and procedures are all for the purpose of, diagnosing or treating some sort of problem that is going on. So I'm going to continue on, just that's a little bit. Again, at the bottom of the page, you have where you can find more information about that. Prescription drug coverage. This is another optional side of Medicare. And again, this is in the original Medicare side. You have the option to add a drug plan on, and the same kind of rules apply. Although it's optional, there is a penalty if you don't enroll when you're supposed to, and that penalty will start accruing at a certain point for all of the time that you didn't have it. The other thing that I want to mention with penalties, no matter which Part B or Part D, those penalties are added to your premiums every month for the rest of your life. So even though a $5 penalty might not seem like a lot, that's $5 added every month for the rest of your life. So we really don't like to play around with people that, are thinking about not getting covered. We try to give as much information as possible so that they can make an educated decision. And a lot of the drug coverage plans, they start at about $11. So something that we see come up when people are kind of new to Medicare, they say, I don't take any prescriptions. Like, why do I need a drug plan? Really just for the purpose of not having that penalty. And you may never know when you are going to need something, but that would be the example that we would use. Even though you don't take medications, you don't want to end up being penalized later down the road. So you can join the prescription drug plans during your initial enrollment period, right? Within that 7-month period, the 3 months before, the month of, or 3 months after. And you can also sign up for a plan during open enrollment, which happens October 15th through December 7th. I'll talk a little bit about that in a bit. With the drug plans, you may pay a plan premium. So in most cases, yes, you're going to pay a plan premium. The lowest plans are about $11, and then they go up. You might be responsible for exhausting a deductible. Some plans have them, some plans don't. And there will be additional drug costs. So by having this prescription drug plan, it is giving you some benefit as far as saving you some money or having your drugs partially covered, but there still is usually a cost to that drug. But at least you're not paying retail price for the drug. And the big thing is that your plan can change every year. So especially for people that do take medication that is typically expensive, you really want to make sure that your prescription is still covered on your plan each and every year. Sometimes we will have it that the plan no longer covers that drug, and that will be the prompt for someone to change the plan. That is really the most important piece of the Medicare open enrollment, is making sure your plan still works for you, because this plan can change every year. So it's best not to just let open enrollment go by and not check on those details. And so my next bullet point is exactly what I explained. Part D comparisons during open enrollment are crucial. They really are. So almost at the end, maintaining your Medicare coverage. This is the only slide, and then I will get into answering any and all questions. Really, the big thing that I want to leave with you guys is check your coverage options during Medicare open enrollment. That is when we're going to get information on if anything has changed for the upcoming year. Just like many employer-sponsored plans, when we are working people, there are time frames to which you can make coverage changes. And once that time frame has passed, that is you're stuck in your plan for the rest of the year. The same thing applies in Medicare. You want to be making sure that you are informed of any changes that are upcoming. That way you can make that change and be ready for the next year. I would hate for the situation to happen, which does happen sometimes, where someone didn't check. They have a drug that they rely on. They find out when they go to the pharmacy in January that that drug is no longer covered on their plan. And then they're calling us to see what we can do. At that point, there's a few things that we can try and pull out, but if they are not, if they don't fit in those qualifications to potentially have an additional time period, they're stuck in that plan. We would offer them this coupon site for saving costs, but essentially they would be paying full retail cost for their drug for the rest of the year. And full retail cost for some drugs, I've seen drugs as expensive as $15,000. I've seen, some drugs that are maybe a couple hundred, still not fun to pay for each and every month. You want a plan that is going to give you the most coverage. And that's essentially what we do. That's why we're so busy during Medicare open enrollment. We're running plan comparisons for anybody that wants one. We're spending time analyzing what the comparison actually says, what the drug coverage looks like, and we're pulling for you the best 3 plans, best as far as what they cost you, the estimated cost, and your drugs being fully covered if that is something that is available. So that's the purpose of what we do. We make it so that you can come to us, we can do it for you, and we can spend time explaining, okay, what is this that you're looking at? The other thing is really understanding that HICAP is a free, unbiased service available to all Ventura County residents. We are not connected to any of the plans, and we are really just here to help you have a better understanding of your Medicare and what your options are. We are able to cover enrollment, so someone that's just getting on or maybe just retiring, coverage if you need help understanding, okay, what for, what are options now, as well as billing issues, appeals, etc. So there's a lot of things that we can at least get the ball rolling for someone for. And if not, if we're not able to help directly, then we're able to usually point someone in the right direction as far as what their next step is. So that is the end of my presentation. This is our contact information. Martha is going to be sending the PowerPoint at some point, and she does have our contact information as well, so I'm sure she'll include that in the email. But as of right now, I am done. I will stop sharing and then we can get to the questions.
Wonderful. Oh my gosh, thank you so much. You did a wonderful job of explaining it and walking us through the steps, but I know for most people listening, each slide probably brought up more questions, which honestly is why I think that being able to call and speak to someone one-on-one is so important, because everybody's individual situation and medical needs are so different. So we're very fortunate to have such an excellent HICAP program available in our community. So we will get to the questions. And I think some of them you probably answered as you were going, but I'll address them anyway, just in case somebody didn't hear the answer.
Perfect.
So starting at the beginning, how much is the Part B insurance premium?
The Part B premium is $148.50 as of this year, and that is subject to change each year. It usually does go up at least a couple dollars each year. So that is it for 2021. We will find out in October what 2022 will be.
Okay. If somebody keeps working for a few years after turning 65 and still has health insurance from their employer, will they still have to pay penalties later after they officially retire and sign up for Part B?
So that's a great question. If you work for an employer, this is the general rule, that has more than 20 employees, and you continue working, you are able to defer Medicare and wait. So essentially saying, I'm not going to pay the Part B premium because I'm already fully covered. And at that point, when you decide to get on Medicare, you won't have any penalties because you were credibly covered while working. This is one of those situations that is best on an individual level, just so that you have an understanding. And there are pieces of that. So we would probably tell you to talk to your benefits department, because at the time that you make the change over to Medicare, and you start enrolling with Social Security, they're going to ask for documentation that you had that coverage. And where you're going to find that is your benefits department. So to put all your ducks in a row, we would say, to be sure that that you're covered, talk to your benefits department. They can give you a form that says, yes, you are credibly covered. And then at the point that you're getting on Medicare, they can also provide, yes, this person was covered for these 3 or 4 years, and then you get on to Medicare with no issue, no penalty.
So at the time that you are deferring enrolling in Medicare, do you have to do any paperwork then?
So technically you don't. However, if again, you want to have my paperwork lined up, you can actually officially defer if you want with Social Security and say, hey, I see that it's my time, I actually want to defer. You can do it that way, but if you were to do nothing, you're still okay. But some people want that documentation that said, I've done all the steps that I'm supposed to.
Sure. And then is that the same for Part A, that you would defer that as well? Or since there's no cost, would you enroll in Part A?
So if you're someone that has to initiate enrollment, it would be the same thing in the sense that you could either let them know or just never sign up for it and cross that bridge when you get there. If you're someone that is automatically going to be enrolled, let's say you started taking Social Security retirement benefits at the age of 62 or 63, then you are automatically going to receive your card, and you will at that point need to tell Medicare, hey, I don't want to join right now, please unenroll me.
Okay. And then in this situation, the person says that their husband is 66 and they're about to turn 65, and they are, both spouses are covered under the husband's company's health insurance. So once that changes and they're no longer covered, he has an 8-month period, enrollment period, then to take on Medicare. Does the same apply to the wife, because she has not been working but has been covered under the husband's employer's plan?
So I would say, to get the official answer to figure out your situation, I would refer to your benefits department and get it in writing that says, yes, this person can stay on this plan past 65 and defer Medicare enrollment completely. Some benefits, or the way that the system is set up, some do want people to sign up for parts of Medicare in that situation, like the spouse being the one that's on it. So I would clarify that aspect. But if not, then the same rule should apply. So if they say, no, you're fine to stay on our plan, you don't need to enroll in Medicare, then the same would apply to you now that you're getting on it. You're leaving that employer sponsored plan. And the big thing is really that it's an employer group plan and not a retiree group, because that's different. So that because your husband's still working, that gives you that credible coverage. If he was retired, you can't stay on that plan without getting over to Medicare.
Okay, thank you. Okay, now this one is interesting. They're saying that their friend lives in Ojai and has Part C, but they have a second home in New York and went there for the summer. He needs medical care for a lung heart situation, but cannot get coverage in New York because there's no in-network services. Is this common, and how does one approach this if they travel a lot?
So what he would probably need to do in this situation is talk to his plan and get the authorization to go to the facility that is in New York, whichever one, especially if it's like an Anthem Blue Cross or something. They do have some sort of usually connection somewhere else, but he needs to ask, right? So if you're just traveling in another area just for vacation or something like that, what is going to be covered with your Medicare Advantage plan is really just emergency services. But since he's potentially living some times of the years, he's going to need to get authorization to potentially go to this other, medical group or whatever. So that's what he's going to need to do if he is on that plan. Now, the other thing is that for people that travel, a Medicare Advantage plan is not there is no travel coverage. It's really just any emergency service. If I'm in Florida and something happens to me, it's an emergency, then yes, I'm going to be covered to go to the hospital. But as far as going for any other reason, I'm going to see problems. So especially for those that retire and, travel across our own country or go overseas, a Medicare Advantage plan is really probably not going to serve you much. You could have another plan really with the Medigaps. There is some foreign travel on some of their plans. And again, they're not connected to any network. So at that point, it wouldn't matter where you live. If you had a Medigap, you can go to any doctor that accepts Medicare. So he wouldn't be running into that problem if he were on a Medigap, essentially.
Okay, thank you. If you choose a Part C plan and then decide that you don't like the HMO environment, can you return to original Medicare with a supplement?
So there is, yes, you can. You can really do that at any point during open enrollment, and especially if you're on the HMO already, that Medicare Advantage open enrollment, you could do it at that point. That's really at any time.
Uh-oh, you just froze.
But when someone, uh-oh, am I back? No.
Hold on, it's catching up. Okay, you're gonna have to repeat that last part.
No worries. I'm gonna try and get my other.
Yeah, it's glitching a little, so you're frozen.
Okay, can you hear me now?
Yes.
Okay, I got onto my other Wi-Fi, so that might help. So the other thing, wait, what was the question? I'm sorry.
So if they
Oh,
are on an HMO Part C and they would like to change to original Medicare, can they do that?
okay. Yes, so you can really do that throughout the year. Throughout the years that you're on Medicare. So that would happen during the regular fall open enrollment, but also during a Medicare Advantage open enrollment. You have the opportunity to go back to original Medicare and apply for a Medigap. But if you are in your first few years of getting onto Medicare, let's say you turn 65 and you try out the HMO and you decide, this really isn't for me. There is what is called like it's a look back period, and you are actually able to make the switch and get on a Medigap pretty much kind of like no questions asked. And that really just happens in the first couple years of you being on Medicare. Beyond that, you can do it, but you might run into the whole underwriting thing. We always tell someone to give it a shot and call around, get some estimates. We had a counselor, a volunteer that worked for us, that after being a part of the program and learning some of the ins and outs, she said, you know what, I want a Medigap. I don't want my HMO anymore. And she called around, and she was about 73, called around, got on one of the best plans, and they didn't ask her any questions about any health related anything. So the protection when you sign up on time is that they are prohibited from asking you the questions about any health conditions. When you are past that time, they have a right to ask, but it doesn't mean that the person that you talk to that day is going to ask. So we always tell people, give it a shot and see what happens.
Got it. Okay, thank you.
Mm-hmm.
If you don't sign up at 65 because you're on an employer plan, will you have a penalty or pay more for Medigap once you do go into Medicare?
So if you're on an employer plan, you are working, you are not going to see a penalty again because you've had credible coverage through your employer. The caveat to that is that really that you're not self-employed and you work for an employer that has more than 20 people. That's the general rule. So you should be fine. So what is going to happen when you do decide to sign up for all of the different the parts and Medigap, you're just going to have that documentation from your benefits department that says that you were credibly covered. At that point, you're basically walking into Medicare like a brand new person. So you're able to sign up for the Medigap and things like that.
Okay, perfect. I think you answered this live, but the approximate cost for a drug plan?
So the lowest price is about $11, and the highest can go up to like $80. Really, that's usually in the types of drugs that are covered is when you're going to see the more expensive plans. The drugs in Medicare prescription drug plans are tiered. So tier 1 is probably, maybe a light blood pressure medication that kind of gives you an idea, something very basic in general. And then as the tiers go up, you could potentially be looking at like cancer medications and things like that. So that's usually if you're seeing a higher cost for the plan, it's usually because they hold higher tier drugs. So it's anywhere from 11 to 80, but generally 11 to about $30 is what the typical person pays.
Okay. Do supplemental insurance companies and Part C plans cover prescriptions?
They do not. Well, I should say the Medigap plan does not. The Part C, which is essentially a managed care, they are taking care of your prescription drug coverage. So again, when we're working in open enrollment or when someone's turning 65, we're usually running a comparison to see what the whole cost picture is going to look like. So that's essentially what we do. And that is based off of your specific drugs. So that's the importance of like the kind of one-on-one is that we're only going to know the best estimate once we see, okay, this person takes 5 medications. These are them. They take them twice a day. And then it's going to give us an estimate of what the total cost looks like.
Does the premium cost of Part D take into account your income?
So it can, really more so if you're a higher income earner. So there are income related adjustments that happen in Medicare, and it's again for higher income individuals. Medicare or Social Security is always looking 2 years back. So if you had a really high earning year 2 years ago, it's based off of those taxes. There are appeals that you can put to get that IRMA that evaluated again, because you will see that you have additional costs, a higher premium. That is one way that it's affected. If in the opposite end, if someone is on Medi-Cal or low income, then there are programs that can help with the costs of premiums. So then once we help someone get on that program, then they're going to see either a reduction of what the premium cost is or the full coverage of that cost.
Okay. If somebody doesn't take any prescriptions and they sign up for a Part D plan, do they still have a monthly premium?
So they still are going to have a monthly premium. And at that point, we really don't need to spend the time to figure out what plan is best for them because they don't take any drugs, right? So we are just saying, pick the cheapest plan. Pick the cheapest plan, and that's all you have to do. But it doesn't excuse you, unfortunately, from paying that premium. You still have to pay that premium.
Okay. Is lowering the Medicare eligible age to age 60 on the government radar?
Not that I have heard of. Not at all.
Okay. Do I need to sign up through Kaiser for Plan C if I'm turning 65? Do any of my premiums come out of Social Security directly, or will I have to set up automatic withdrawal?
You can do either. So typically, when you sign up for like your Part B premium, that's going to usually come out of Social Security. And then once you get to the point of making your decision for, let's say, Kaiser, you have the ability to choose whether that comes straight from Social Security or that you pay it monthly, or sometimes you can pay for the year in advance. But you usually have the option of what you want to do. Same with the Part D as well for the drugs. You can allow it to just take from Social Security, or you could pay it monthly.
Perfect. Okay. Sorry, there's a few questions that seem a little more specific. So I'm asking people to provide email addresses so that we can respond to them directly after, because it is 4 o'clock and I want to be mindful of time. So if people would just put an email in for me, or just email me directly that question, and then I can have Audrey respond to you personally. So just one other general question for the Medigap plans A through N. does the grid that you mentioned give an idea of the monthly cost?
So we do have 2 grids, so I can show you. I can send this to you, Martha, if you want to send it to everyone, because this is usually something that someone wants to look at. We have a grid of what's covered, so it'll be like check boxes for all the services, and then we don't upkeep this form anymore. It's from, I think, 2020, but we do have like a sample rates, and that sample rates was from Ventura County. Now there are other ways to get a better estimate on what you would pay, but if you want to just look at the general of what each of the plans cost for all of the different companies, then we have that as well. And it gives you an idea to kind of a general starting point if you're looking at a particular plan and particular company.
That would be great. And then I'd be happy to send it around with the slides to everybody.
Perfect.
Good. Okay. Well, thank you so much, Audrey. This has been such important information. I'm sure people still have questions, so please just know that HICAP is there for you to answer your individual questions. And tomorrow I will email everybody that signed up for today a copy of the slides as well as that grid, which will include the HICAP contact information and also a link so that you can view this recording, so you can go back and see anything that you might have missed. So I appreciate you so much, Audrey, for your time, and thank you all for joining us. Our next seminar will be on September 14th, and it will be updates on Alzheimer's research presented by UCLA. So you can go on to the seniorconcerns.org website/seminars, and you can register for that one there. So again, if I didn't get to any specific questions, I have a few emails here to follow up on, but otherwise, please reach out to me or contact HICAP directly. And I thank you so much, Audrey, for joining us today.